Cool. Okay. Right. Let's talk about death.
Yes, that's an interesting topic.
Yeah.
One that people don't really like to talk about, is what I find.
Why? Why don't we like talking about it in this country?
I suppose it's a scary topic, is what I tend to. There's the feeling I get from people. People don't want to talk about it, especially when they're maybe faced with an incurable illness of some description, whether that be cancer or any other sort of neurological condition or lung condition or anything like that. Because it's almost like I wonder if people are scared to talk about it because it's a means to an end almost. If they talk about it, they're admitting that it's happening. But I'm not sure that's always a bad thing, as in admitting that it's happening. Talking about death is, well, to me, quite an important thing, I feel. How do you feel about it, those sort of conversations? How did you find having those sort of conversations? Did you have those sort of conversations actually with your brother and things like that?
So I've been racking my brains about whether I don't think we talked directly about death, as in like in a biological way. That didn't really come up. But everything but, what are your actual final moments, which, as laymen, the general public, you don't know. And very, very few of us have experienced that and come back, So we didn't talk about the literal final moments. We prepped everything before. So there was an acceptance. Like Rob, because the sort of death that he was having, because once you're told you're terminal, you're on a ticking clock almost. We had those conversations and we prepped around, like planning his funeral, about what he wrote a letter to the family. He talked to me and my brother about what he wanted, how he wanted us to support mum and dad and everything like that, because he'd had, a whole year of them in the hospital, seeing what was going on, their whole grieving process, and that possibly the worst thing that could be happening, losing your child. So he prepped us in that way as well. So yeah, we had the conversations around death, and that was led by Rob. And I think a lot of that was because he was from diagnosis to death was about 10 months. And, 8.5, 9 months of those were completely out of his control. So Rob made the decision to stop treatment. And I know he was scared of death. I know he was scared because at the end, even as a 24-year-old, he was back living with mum and dad, and he would ask mum to stay in and stroke his hand and massage him whilst he fell asleep, because he was like, I'm terrified of dying on my own. So there was a fear there, but I think he was trying to control as much as possible, which, as a young lad, when that had all been wiped, his whole future had been wiped away from him. I think that's really important. That gave him a sense of stability towards the end.
Did he just make that decision by himself? Do you know what, when I am actively dying, I'd like to go into the hospice?
So that was definitely a conversation with the hospice, which was basically, here's your options, because we'd never come across a hospice. Before me and my brother were born, or very young for my brother, most grandparents had passed, and my granddad, passed peacefully in his sleep. So the hospice wasn't something we'd come across. Death wasn't really something we'd come across that much in the family.
Some people will think, yes, I want to be in the hospice because there's nursing care there 24/7. It relieves families, like it did for your family, and that's what the hospice does in the inpatient unit is fantastic. Being there for the families and obviously the patients and friends even as well. It's not just about patients and their families, it's friends as well. But it's also about how we can deliver that in the community sometimes as well. And I think people will never realise maybe what can be delivered at home sometimes. And everyone's very different in their want when it comes to end of life care. A lot of people are very adamant, I don't want to be at home, and that's fine. That's absolutely fine. Some people do want to be at home, and that is also fine. But it's the importance of having those conversations sometimes in time.
Yeah.
If it's appropriate and if people are willing to have those conversations, because not everyone will. And it is about, at the end of the day, we have one chance to get it right with someone's death. We don't get no do-overs. We don't get a second chance. We get one chance to get it right. And that's why the conversations sometimes are so important. When your loved one is dying, you feel a bit helpless maybe, because you don't really know what to do to help them in a way, especially at those more end stages. So right more near the end of life. And sometimes we feel as families, maybe we can give them food, we can give them water, you know, we can try and care for them as well, but that can have its own burdens on family as well. And again, I see it in different ways. Some families want to do all the care for their loved one and be there, but there's others that don't. They just want to be a mum or a brother, and it's an individual decision at the end of the day. But I do always try and advocate a bit for let us supply you with some help. Let us get you some support so you can be a mum, a brother, a husband, a wife, you know, a sister, whoever it might be, just to give you that personal time, so you're not constantly worried about washing and dressing and toileting and all those other things. You know, you want to be making memories at the time, and that even is another important conversation to have as well, you know, to allow people to have that choice and have the end of life care that they want and deserve. You know, everyone deserves what they call a good death. You know, it's
absolutely,
a good death is a phrase, and there is such a thing as a good death and a bad death, we believe. And these conversations help to provide a bit of a good death. You know, there's lots of other factors around a good death as well, but planning so we know what to do and making that happen at the end of life really, really can make a difference as well.
Yeah, I completely agree. And there's a good death and a bad death, I think, for the individual and also the people that are left behind. Because like you say, a good death for my brother was very much in control. That was, you know, a good death was whatever he could control and whatever he could decide and decisions he could make to make, you know, all the preparations, have those conversations around it. You know, the death itself is the death, and that came unexpectedly, but everything had been prepped. You know, the whole thing, Rob knew everything that would happen after his death, the funeral, all the jokes, all the silliness, all the celebrating, and all that, which was great. And then the good death for us from our side was that those 9 days we had in the hospice. You know, we went to the zoo. Rob was a zookeeper for the day. My brother took him to a heavy metal concert up at Wembley. You know, and the hospice is, again, as we've spoke about, is more than just a hospital bed, isn't it? The greatest memories for me, and this is where it comes down to the absolute simple things, was it was Christmas time, and you guys have got the communal room, haven't you?
Mm-hmm.
And we just watched American Dad, because that's what we did. We would sit and watch Family Guy and American Dad, and I remember just watching box sets with Rob and playing board games, and that was it. That was the normality, and that's what made it a good death for us, because we got to be a family. Sorry, I'm getting a bit emotional. Ooh. Yeah, so that, you know, there's the good death for both sides, I think, and that's really important. That does come down to communication, that all of that. It's death plans should be as common as birth plans. The worst thing in the world is thinking, in that scenario when everything's happening, did I do right by them? Did I do by the best wishes? Could I have, you know, was I too busy with the medical side to ask them what their favorite color was, or record their voice, or anything like that? You know, you want that time to be able to step back and, like you say, you guys, the professionals, to come in and just alleviate a bit of pressure so you can just tie all the other things up. What do you consider a good death? What's, from your professional perspective, what is a good death?
Part of good death is even things prior to them, actually, that moment where they die. It's things leading up to it as well, I feel. And it's like, if they have wishes they want, like with Rob, with the heavy metal concert, you know, and doing that thing, hanging out with you guys in the communal room, playing games and everything, you know, all of that contributes to it. And, you know, if it's even as far as someone wanting to go and sail a boat on a boating lake, you know, if that's part of it and it helps them fulfill those wishes that they want to do before they die, then that all contributes to a good death. So for me, it's that run up to it, not just that moment. It's that whole time, you know, where they recognize things are starting to deteriorate, and it's about putting things into perspective. What do you want? What do you want to happen? You know, what things, if you could just do one last thing, what would it be? And it'd be about making that happen as well. And if we can do all of that, you know, some people, it's just, I just want to be at home with my family, you know, or I want to come into the hospice and have my family around me. If we can do that, then it's a good death. You know, symptoms can play a part as well. If we can get people completely 100% symptom controlled, brilliant. That's definitely a good death. But even sometimes symptoms can be really hard to control, especially things like pain, especially if there's a an emotional aspect to the pain. So we can't always guarantee we're going to fully control someone's pain, but we will do the best to make it bearable. And if we can do that, then fantastic. You know, if someone is happy with how they are, then that's sort of a good death to me. So there's lots of different various ways of making a good death. But I think majority of people are lucky enough to have that. And for some people, it is literally just having their loved ones around them, whether that be that they're in hospital or, you know, on a street somewhere or wherever it might happen. If what they wanted is for their loved ones to be with them, as long as they've got that, then it's a good death in my professional opinion, if you like.
I think that's so important, isn't it? Because it is about the whole process. It's about the lead, like you say, it's the lead up. I think that's super important, and that's, as we say, good death for both. Everyone involved then has a good death because you've made those memories. You've had time to have those conversations and plan everything the best. Yeah, that's awesome.
And one of the things that the hospice has spearheaded for many years now is something called the My Care Choices Register. And we've got this, we use the really fancy little booklet now, which is really, really good, because it allows people to read through and it sparks some thoughts about what would you want to do, you know, if you're in end of life care, where would you want to be cared for, how do you want to be cared for? And I try and encourage my patients to think about the little things when it comes to death and dying, or not just about maybe where you want to be, or, you know, would you want this medication, would you want that medication? It's about the little things like, do you want music playing in the background? Do you want people around you? Who do you want around you? Do you want pictures on? Do you want a particular TV program on? You know, all those sort of things. And it's those little things that I think help, going back to that good death side of things, that help with someone's death and dying, that can just make the whole situation a bit more of a relaxed situation. Obviously, we know it's a very emotional situation. It's a very sad, stressful, no one wants that time to come, but we do know it's going to come to all of us at some point. And unfortunately, some a lot earlier than it should do. So why not make those plans and make it as good a death as possible, you know, for you and your family. But then also, in a way, I feel it helps with the grief post someone's death as well. You know, if you've made those plans, and as much, and I think, and a lot of people say this to me, and I agree, again, from personal experience, as much as you can plan as well for someone's death and you know it's coming, when it happens, it's still a massive shock. And I don't think there's anyone that would say that it isn't, because as much as you can prepare yourself for when that moment comes, it's still completely different because of the emotions you're filled with. And I do wonder whether, you know, if we do make those plans, we have those conversations, people know what they want, is it going to make the grief process that little bit better? Because in a way, you've started that grief process because you're having those open conversations.
So I totally agree. In hindsight, when you're in the eye of the storm, obviously hard. I would never say I was totally eyes open to all of this way back then. But, you know, upon reflection, I couldn't agree more. I think these conversations do start that grief process. And I think they help, even if you're having them, like we've just talked about, with wives or partners, brothers, sisters, mums, dads, way before. Part of grief is that huge absence and that gap. And if you've got gaps in information and gaps in judgment and gaps in, you know, those what ifs, that just adds so much more pressure. Was that what they wanted? Is that, you know, did we say all the right things? Did we do the right things? But if you're playing their favorite playlist with the people they want around there, telling them how much they love them, whilst, you know, scrolling through pictures of their children, ideal scenario this sounds like to me, you know, then you're like, well, that takes away that what if, that pressure and all that, which would just be so mentally tough. You'll never be fully prepared for the death part, but you can prepare the before and after as much as humanly possible to see you through it.
Yeah, exactly. And, you know, when that time does come and your loved one does die, and then obviously there's that time of mourning after someone has died and the funeral, there's still that grief to deal with, isn't there? That's there as well. How did you find dealing with the grief? How did you sort of deal with that?
Not very well. I talk quite openly and honestly about this. I was not in a good mental place. Rob was like big brother, best friend, rock in my life. So at the time I was living an unhealthy lifestyle, a lot of alcohol, a lot of partying, not a lot of reflection upon what I was doing, because I was just, you know, hurting and didn't know how to express myself. So yeah, that was sort of during his illness into his death as well. So yeah, I was in a pretty dark place, to be honest. But the one thing that turned it around was my now wife, my beautiful angel of a wife, basically turned around and said, go to grief counseling or I'm leaving you because you're an idiot, which is the best thing she's ever done to me. So I called up St. Helena and basically just went in and talked to someone. And yeah, I think I had 6 sessions, which I think was standard at the time, although they offered, you know, it was open at the end. The first session I just sat and cried literally for an hour. I don't think I said anything. I just cried, you know, like proper snotty, blubby child tears, you know, when you're like snot bubbles and everything. And that was very cathartic, much healthier than just drinking yourself into oblivion. So I felt good after that. And then I came back the next week. I probably cried for about 40 minutes and then talked for a little bit about Rob and life and everything. And then the next time, maybe 50-50 split. And it just came down to, I remember the last counseling session, we were just talking. Although everyone around you was being amazing and supporting you the best they can, I just felt everyone was too close to it. You know, you're still in the eye of the storm and everyone's sort of circling around you, whereas you can remove yourself into this calm oasis. That just cleared my head. And we don't care for grief, do we? We take it with us, and that's the point of it. So we've got to, I think we've all got to learn to just accept that it's part of the human journey, just as death is. These things, as a community-based human race, you know, these things do affect us, and they will affect all of us. So, you know. But it's the weirdest thing to shy away from, isn't it? Because we are all going to die. Like, it's not the
one thing we know. There's 2 certainties in life. You're going to be born and you're going to die.
Exactly. You can avoid taxes. No, you shouldn't. But honestly, so great chatting with you. Thank you so much.
You too. No problem. Pleasure.
Talking and sharing.
Nice chatting to you.
And yeah, all the best. And you're doing, you know, what you do at St. Helena. Huge respect for, and we'll always support. So thank you for all of that as well.
Thank you very much. We appreciate that. Lovely.
Awesome.
You take care. All right. All the best.
You too. Thanks, Josh. Have a good day.
Yeah. See you, Toby.